Yes, sir. We are just preparing for live stream.
Very well. All right. Good evening, friends. Good evening, Dr. Sanjeev Shah. Welcome on board to our today's station. Friends, I am Shrenik Shah from Ahmedabad, and I am stage 4 Google Board Cancer Survivor, and this is my 28th year of a cancer survivorship. Apart from that, I am Indian. I am patient ambassador of Indian Cancer Society and moderator of the Friday Speech Planning webinar. We have successfully completed 9 sessions, and since the this month, October month is about the breast cancer awareness month, we have a very eminent histopathologist and cytopathologist, Dr. Sanjeev Shah from Magnus Ahmedabad. He has joined us to share his expertise, knowledge, and experiences with us. Now, before I introduce further Dr. Sanjeev Shah, let me just share what exactly the role of histopathologist and cytopathologist. You know, you guys are seeing KBC, you are seeing the Pachacha and the audience and us and everybody. But when when the show is started, making the show spectacular, remarkable, the this is not possible without the operation inside the room or on the back end. So it's like the performance behind the role, behind the curtain, and this is what exactly Dr. Sanjeev Shah is doing. I mean, as a histopathologist and cytopathologist, you know, he is rather analyzing the biopsies and other stuffs during surgeries, and particularly cancer surgeries and other surgeries, and based on his report, based on his analytical and histopathological report, the cancer surgeon, they are planning the surgery, they are performing the surgery and other treatment protocols. So this is the role of histopathologist and cytopathologist. Dr. Sanjeev Shah, sir, welcome on board, and stage is all yours now. Kindly share your knowledge, experience, and expertise, and thank you for your valuable time.
Thank you for introduction. Just a minute, I will share my PPT.
Sure, sir.
Okay. In continuation to introduction given by Mr. Shrenik Shah, all of you should understand that histopathology is separate, very specialized branch of laboratory medicine. It's totally different from clinical pathology lab, which is doing routine blood, urine, or stool examination. And you should take specialized opinion for histopathology, report biopsies, and cytology. I have lab in Ahmedabad, Magnus Specialty Laboratory. Uh, Today I'm going to talk about role of histopathologists in cancer with special focus on breast cancer. I will talk about a basic aspect of cancer, in which patient it occurs, which age it occurs, what are the etiological factors, how we diagnose this mm, entity, and cost factors, and then we will go to question answers. Uh, Majority of breast cancers are environmental induced. Uh, our lifestyle has drastically changed to Western lifestyle. We are more of high calorie diet. We are taking lack of physical exercise. And for the breast cancers, the age of marriage also has been almost 1 decade older. Initially, women were married in the age of 18, 20, 16 years and were getting childbirth by 22 to 25 years. Now the marriage age, first child age also has been almost postponed to 1 decade, 10, almost 10 years. We females are getting less and less numbers of child. The breastfeeding also, because of work pressure and for cosmetic reason, breastfeeding instead of 8 to 12 months, which was previous concept, now only 4 5 months only breastfeeding is being done. So because of all these factors, plus it's very, you can say, very unusual that now in female also, a high number of females are doing smokings and alcohol consumptions. That is also one of reason for the increased number of breast cancer. Apart from that, about 5 to 10% patient can have malignancy breast cancer because of genetic abnormality, and that cancer goes in almost nearly all family members. Uh, Breast cancers, majority are in female, but we have seen that it can occur in male. So male also should not neglect. Although it's very rare, in my 20 years, I have seen only 3 to 4 breast cancer patient male. It usually occurs in the middle-aged patient, maybe late 20s, early 30s, starts and goes up to almost 60, 70 years. But it can occur very early as 20, 22 years. So younger female also should not neglect anything unusual happens in her breast. So how to diagnose this? Early diagnosis is important because these breast cancers spread in different areas of body before it being noted at the breast site. So early diagnosis is a very important. And it's possible. Why it's possible? Because breast is external organ. Clinicians and person herself can examine her breast. So its early diagnosis is possible and important. This is era of personalized medicine. You should be very careful doing Google search. Google search may be sometimes misguiding. In cancer diagnosis and treatment, experience is required. So whatever report or anything you get, you can take a help of Google's, but it should not depend on that result. Those results you have to consult your doctor, experts in that. Now there are three tests, triple test we call for diagnosing breast cancer. One is physical examination, which can be done by person. I'm not telling patient here because it's at present not diagnosed. Physical examination can be done by lady, or second step is imaging, that is radiology, and third is histopathology or maybe biopsy or cytology. Your healthcare worker, your gynecologist or your surgeons can teach you how to do self breast assessment, and from that you can diagnose it. Sometimes what happen, if you go for regular checkup and physician do your chest examination for heartbeat or your respiration, at that time also he may find that there is something abnormal. That may be the one of way to die. It may be diagnosed. Second is health checkup. There is now a lot of hospitals and independent centers are doing health checkup, and mammography is a part of health checkup. Because of this, early detection of the breast lump is possible. I'm not telling cancer, breast lump. It's not may not be necessary cancer. It may be some simple lump, and you get a report with scoring, Byard scoring. If you are doing this mammography testing, some of not good centers give report without score. You have to insist that you give us a score, because based on score, your clinicians will decide whether to do further take a further step like biopsy or FNAC, or just to do repeat mammography or repeat checkup after 6 months to 1 year. So this scoring is important and it should be insisted. If any doubt is there, that is higher, more sensitive technique is breast MRI. This is recent technique that also can be taken help of. Once it has been detected that there is a lump in the breast with Byrd score of about 4 or above high, it should be sample. We have to take sample from that lump. Now, there are different techniques to take samples from the breast lump. There comes role of histopathologist. Now, this thing you have to remember that histopathologist is first clinician. Its role starts with the examination of the details of the patient, its radiological finding, and then its role comes in reporting of the sample received in his or her lab. So whenever you go to histopathology lab or any person comes to you to collect sample on behalf of histopathologist, you have to submit your entire file, including your previous reports also, blood reports, radiology report, previous surgery report, your family history, everything to be given to histopathologist. And sometimes what will happen after doing this, taking a sample, more investigation like PET scan or any higher testing has been done. That report also you send to that lab. You can send that report PDF to on WhatsApp, or the reception number will be there on WhatsApp. You can WhatsApp that report on the reception number. Now, there are two techniques to get a sample from the breast. One is fine needle aspiration cytology. I will use the word cytology only. Second is surgical biopsies. Okay, by it may be by doing a needle biopsy, or surgeon may excise entire lump. I will just tell you how we are taking out these samples, and then we'll tell you which technique is better. This will help your decision making, whether if you are getting lump, whether to go for FNAC or cytology, or you go for biopsy. See, yeah, cytology is nothing. This, if you say here, this is a. Can you see my cursor? Yeah. See, this is like dummy lump. It's a breast. Is there is the lump inside? We put a needle in this lump and take out the material from lump. Okay, this is actually, this is breast, this is lump. If it is clearly palpable, we can feel it directly on the breast. Pathologist or surgeon can take cytology samples directly without any assistant. But if it's deeper down located, we can take a help of sonography guidance and and the radiologist. Under sonography guidance also, we can take samples from the breast if it is deep located in a small lesion. Once we get the sample, we spread the sample on the slides, stain it and examine and decide whether any malignancy is there or not. The advantage of this technique is that we can give a report in, if not a busy schedule, in 1 or 2 hours also on the spot, or may take 1 to 2 days. But I personally prefer not to give report immediately within 1 or 2 hours to patient, because if it is of cancer and immediately I inform patient that you have cancer, there will lot of mental trauma, psycho mental disturbance to patient, and usually only 1 or 2 person accompanies with this procedure. Better I send a report to your clinicians, and he or she explains you about the whether this your cytology is for positive for malignant cells, or is it just a simple lump, nothing to be done, or maybe some simple excision to be done. Second is doing biopsy. Usually for diagnosis, biopsy is done by wide bore needle. It's known as true cut biopsy. In true cut biopsies, we get a like big core that we put in one cassette and process in tissue processor, and different steps are followed, and we get sections on the slide, and we report that. If you see, specimen may be uh, as small as like only core, small thread, or surgeon may remove big lump. We take samples, put in the cassette, process and prepare the block, and from block we prepare a slide and examine it. This is simple first steps testing of biopsy sample. Now, for the processing of the disc cassettes, there are two different types of tissue processor. We call it biopsy processor, but there is a vast difference in cost of these two machines. Just to explain you later on, I will discuss about the costing aspect. That's why I'm telling you. If you take this machine cost is 1x, this machine cost is probably 5 to 6x. Uh, Advantage of doing biopsy over cytology is the more sensitive and specific methods. We can do additional testing from this sample. If you see in this block, there is a already tissue or biopsies there even after examining the one set of slides. So we can do, if you want to do additional testing, we can do from that tissue. Whereas problem with cytology is that once you spread the smears on the slide, you cannot do any other testing on that. So cytology in the any cancer, it should be avoided. It's only give information of whether cancer is present or not. It does not give any other information about the therapeutic test which will be required in future. This technique take 1 to 2 to 3 days for reporting. Now, what to expect from the pathologist or your report? Now, if you take the clinicians or clinical examination, after that there is one step of radiological investigation. If you take radiological investigation like mammography or MRI, there is one more step of doing FNAC or biopsy. If you take FNAC, there is one more step of doing biopsy. But after biopsy, there is no other test to confirm whether you have cancer or not. You can go with your blocks to other pathologists, but there is no other modality of testing beyond the biopsy. You can call this histopathology or biopsy as Supreme Court or final word making specialty. So no higher checkpoint is there. To give proper time to pathologists for reporting, give as much as information, whatever clinical findings, whatever radiology findings to the pathologist for proper reporting. Now, this is one dummy report. I have prepared it. What to expect, what to see in your histopathology or cytopathology report. First thing, obviously, you have to check your name. You have to check the number. One number will be written. Same number will be written on your slide and block. This is different number because this is a different patient slide and block. But this number 7442 should be written on your slide and blocks, which is given along with report. For the breast, is very important to see the whether the pathologist has written whether it's a right breast or left breast. That's very important because in future, lady can have cancer in the other breast, and if in the he get cancer in the left breast, and that time also pathologist doesn't write whether right or left. If you go to oncologist to report, he will not able to decide except he sees the clinical findings and radiology from which breast these reports are. So the mentioning of the side is very important. If it is not mentioned, you can ask your pathologist to write from right or left side, which side it's been taken. Apart from technical aspects, diagnosis whether you have cancer or not. At least in my report, we write all stain slides and blocks label, same label as what is present on the slide and blocks, written along with report. Please preserve them carefully. Okay, and specimen will discard after 1 month. Sometimes, if it is big specimen, we keep for 1 month. If you want to take back and get re-examined from other pathologists, histopathologists, it's possible. Or if it is small biopsy and everything is been put in that block, You can ask that histopathologist to examine that block. Now, I will tell you what to do with these slides and blocks which has been given to you in record keeping topic, which I will discuss later on. There are two categories of tumor. If you see, this is a normal breast ducts. There are two categories of tumor. In one category of tumor, cancer cells will remain confined within the duct. This type of cancer do not spread outside your breast, will remain within the breast. Second type of cancer will be those which goes beyond your breast ducts, and this cancer can spread to your axilla and to different other part of body. These are two type of cancers, categories of cancer. There are a lot of subtypes of cancer, but these are two main categories of tumor cancers which can occur in the breast. Once the lady has been diagnosed that she has a cancer, next step is to do prognostic test. What prognostic and therapeutic test? What sort of treatment to be given? For the breast, there are three main type of test: two hormones and one receptor test. Hormone receptors are estrogen receptor, progesterone receptor. These two are, and HER2. This is HER2. These three tests are usually done. If tumor is low grade, means not dangerous looking histologically, we do testing to decide how rapidly it's a doubling, how rapidly it's a proliferating. Okay, so that also we decide. These are the four tests we do. These reports also will be included. There are different companies which are offering this reagent to us, and the results are quite variable. So in your report, you have to ask histopathologist, okay, write company name, which company test or reagent you are using. There are two different methods for performing this test. One is manual technique, left hand side. This is like humidity chambers. And this one is right hand side is fully automated Ventana autostainer. Uh, there may be quite significant variations in result with these two techniques. If you see cost wise, this humidity chamber one will this this chamber cost itself is only 6,000 rupees. And if you see this machine cost, it's almost 48 lakhs rupees. So quite a bit of costing difference are there. I will tell you why I'm telling you about this costing part. Sorry. Now, sometimes what will happen, your these HER2 results will be equivocal. Is either not positive, not completely negative. It will come in between. Then we have to check it with higher testing, that is genetic testing, which is known as fluorescence in situ hybridization. Whether that in between results are negative or positive, which is in short we call it FISH, fluorescence in situ hybridization. Now, many times patient ask me on the small biopsy, which stage cancer is there. In the small biopsy, we will not able to tell you exact staging because the staging is decided by size of tumor. In the small biopsy, I will not know what is the size of tumor. For that, we need a big specimen, entire specimen to be removed like this. If we get this specimen, we can tell you the size of the tumor. In the small biopsy, we'll not able to tell what is the size. Then we have to decide how much spread is there in axilla, which is known as nodal stage. And third, whether it has been spread outside the breast and axilla to different part of body like bone, brain, lung, liver. And then only we'll able to tell you staging. The exact proper staging will be decided by oncologist, not histopathologist. Now, what we expect from patient? Now, always insist for quality rather than fast report or cheaper report. Quality always comes with time and cost. And bring your entire case file along with your biopsy request, or you can WhatsApp. Why I'm telling you repeatedly? Because we have done found a lot of difference in ultimate diagnosis with feedback from patient. You can discuss patient report with pathologist with prior appointment. Avoid telephonic consultations. We avoid telephonic consultations because it create confidentiality issues. We don't know on telephone who is talking on at other end, and sometimes patient do not want to disclose or report to other person, maybe even not to father or mother also. So better we discuss report physically, not on telephone. And never insist soft copy of your report before you consult oncologist, because if you get a report, you start searching on Google and get disturbed, and you will not get proper guidance from, and different opinion will start coming who are actually not oncologists. So don't expect report on soft copy, WhatsApp or email. You can get those reports once you consult your oncologist, get proper guidance, and then you can ask lab to give soft copy. Blood, urine, and stool tests are different. All are numerical tests. It's a just plus and minus. Here, a lot of text will be there. You will not able to understand what we have written. Lot of technicalities there. So never insist soft copy before your consultation with your doctor. Many people ask that give me report. I want to file a mediclaim. So we cannot give a report for mediclaim until and unless we have done our work thoroughly. Now, sometimes what happens, the tumor is very small. It can be removed without removing entire breast. Small part of tumor and surrounding breast can be removed, but we have to check whether whatever has been removed properly. Second thing, uh, during the time of removing the breast, surgeon remove tissue from axilla here, and if majority of time entire tissue has to be removed, but it comes with complication. If you see that this patient hand, right hand is almost like elephant, like very enlarged hand. It's known as lymphedema, edematous hand. We can avoid it. To avoid this one, what surgeon does, the surgeon puts some dye here, and that dye will go in axilla and will take out a part of axilla which is showing dye. And that this breast tissue tumor, your tumor with breast tissue and part of axilla, they send to us during surgery, which is known as intraoperative consultations, and we freeze that those tissue and tell surgeon that whatever has been removed from the breast has been removed properly. There are no tumor at the cut area. Wherever you have cut, there is a normal tissue only. The tumor has been completely removed. And second, we tell what whichever part of axilla you have sent to us is not showing any tumor, so no need to remove rest of axilla, and patient will not get that big hand lymphedema, which has a lot of complications. But remember this, uh, we usually give reports in 20 to 30 minutes for intraoperative consultation, but it has a limitation because we are not getting that good sections. But it's quite helpful. Intraoperative consultation, or you can say frozen sections, are quite helpful. Now, once it has been decided that you have cancer, your all hormone testing has been done, your staging will be done by PET-CT scan or other higher radiological modality. Surgeon or medical oncologist will decide whether to directly go for surgery or give first chemotherapy. Whatever it is, ultimate plan is to do remove that part of the breast or entire breast, and that space tissue they send to us, and we report on that. That is known as resection specimen. On resection specimen, we give lot of informations which is which it's out of uh, domain at present. Everything has been done. Next stage come genetic testing. Most common gene in the breast cancer is BRCA mutations. It is helpful for therapeutically and for family screening. It has a family screening role. Sometimes, apart from BRCA, other genes are also mutated, and that will be detected by hereditary cancer panel. So, if any abnormal genes are there, so oncologists will offer you treatment for that, and this they will check up for that particular gene your family member, blood related, not other. In blood related relative like your mother, sister, maternal aunt, they will check for that. And if that abnormality is detected in any of your blood relative, there are two options. One, to do regular, more frequent checkup of both the breast, or if breastfeeding and family has been
अजमेर में रोड वाला बोल रहा हूँ वो कहीं वो ड्रॉप वाली एजेंसी समझ गए
and if family has been completed, person can lady can opt for prophylactic removal, means without cancer, opt for prophylactic removal of both breast. Best and famous example is Angelina Jolie, who had BRCA mutations and she removed both her breast. Now, what are the quality check and cost part? Already told, quality comes with time and cost. Different costs for different modalities of techniques and instruments. Different reagents also has a different cost. One example I can tell you that one reagent which I am using maybe costing 1 lakh rupees of one company will cost me about 55,000 rupees of other company, but quality is totally different. So different lab will have different cost for same test. So don't go means compromise in costing. Spend as much as possible in getting good diagnosis. If this diagnosis is wrong, your entire treatment will be wrong. Now, where to go for quality report? Now, you have to remember all this interpretation of histopathology and cytopathology is manual, and all manual technique has some limitations. That suppose I am them, I can report 25 patients per day, not more. Maximum I can increase 530 patients. Beyond that, we cannot report it. So it is not like clinical path where nearly everything has been done by machine. So this is subspecialized branch and insist for experienced people. Many times patient take opinion of other pathologists or other GP, you can get a general practitioner or some laboratory technicians. These histopathology's report are such a specialized report that except histopathologists and good medical oncologists, nobody will able to judge this report. So don't take opinion of any general practitioner or any clinical pathologist or any laboratory technicians about these reports. And these reports are subjective also. What I feel is a one diagnosis, other person can differ in that one. So always go for experience and quality. Don't see for the cost. If you see my business card, my motto is the results you can trust. Never compromise on your quality, because this is medical field is probably one of the field in which expectation is 100% result in 100% patient. So always go for quality. Don't compromise on cost. Now, what to do with these blocks which we are giving to you? Always preserve this block, even if patient is expired, particularly in oncology. Suppose one mother is getting cancer, breast cancer, what people do, they discard the blocks once patient is expired. No, these blocks will be helpful to patient, but also will be helpful to her daughter in future. If you want to study your family members, whether a particular gene is present in my family or not, you can check You can check your mother even if she is expired, and this is your medical property. Instead of putting gold and money in locker, always you have to put this one in locker, and it should be away from the rat. Rat eats up the tissue present in the block, so keep it away from the rat. If you are taking in summer outside for testing, always put some thermocol or anything which prevent melting of wax. This white is wax, and extremely it melts down. Nothing happens to tissue. You can again repair this block. Okay, you can put it in one box. These blocks, even if tissue is the wax is melted, tissue is present. You can again ask pathologist to prepare the block. Okay, and one more suggestion is that one prepare one WhatsApp group of family member. Suppose patient is suffering from cancer, you may avoid that patient in group, but you can make a group of husband and children and put all the soft copies of report in that one. And if you want to share anytime to any doctor, you can share it. That is one suggestion from my side. Is almost I have completed what I felt to be told to the general public. I tried to include it. If any questions are there, I will try to answer it.
Dr. Sanjeev sir, thank you very much. You know, this is our fourth session pertaining to the breast cancer awareness month, and we have one more coming up in the on next Friday. Now, coming to the attendees, friends, we at Indian Cancer Society are bringing up the best, not bad, but best of the best medical professional on this platform for sharing their knowledge, expertise, experience, and so on. And we deeply support women empowerment, and therefore, this is fourth session and fifth session will be coming up on the next Friday. Now, why we are bringing such session? Say the oncologist and histopathologists and particularly cytopathologists, they have their own priorities. That's number one. Number two, whatever the details Dr. Sanjeev sir has provided, you may not be able to get hold of such information during private consultation because of their own priorities and so many other obligations. So, the information what Dr. Sanjeev sir has provided is quite remarkable, in assessing your physical health and in terms of cancer early diagnosis. And yes, we are bringing this specialist only for a simple reason, like we do not want you to play short in dark. I'm repeating the word. We are we are we do not want you to play short in dark, because lot of informations are available on various web browsers, but each and every single information may not be coordinating with your own issues, and therefore we are bringing this specialist, despite their heavy engagement and lot of commitment. They are respecting our request, and they are coming on our uh, platform for their knowledge sharing. Usually, let's open the room for the questions.
Sure, sir. Dear participants, if you have any questions, you can unmute yourself and ask questions from the doctor directly. But one by one, please. So, okay, if nobody has, all right, there is a question, I think.
I think they did not understand or I explained everything very nicely.
Exactly, sir. Actually, somebody has to, like, if they have a question regarding their report, they can only ask.
Good afternoon, teachers. Sir, I have one question. When
Yeah.
basically women from rural areas they got if they get breast cancer, you know, after hearing the word cancer, they got lot of panics. What to do next? How to deal with it? So in these conditions, how to help her in mental state में उसका mental state कैसे control में रखना चाहिए क्योंकि क्योंकि वो ये सब सुन के घबरा जाती है.
Yeah. Patient counseling is many times very difficult. Mm, uh, from village, people will not be that literate, and we can avoid using word cancer for those people. We can use word simple word like mass or tumor, not word cancer.
Yes, sir.
से गुजराती में बोलते हैं जब इसे हिंदी बोलते हैं कि जहरी घाट है. Don't use those word. We can explain her that its treatment is required. Don't neglect it. Negligence नहीं है वो. That's very important. Village people neglect that this is like anything. We have to just counsel the trick a treatment. And cost is definitely issues. They can go to government cancer hospital. In Ahmedabad, we have Gujarat Cancer Research GCRI. She can take help from that. And there will be, I think, medical oncologists and I think some of the cancer centers have a psychologist or psychotherapist for this particular problems. Some of patient get psychosis by hearing word cancer. That's why I told you in my session that I don't disclose report, particularly FNAC report. If in FNAC is like cytology is like that, if I do FN procedure within 10-15 minutes, if it is straightforward, I can make out this is cancer. But I don't disclose and such a reports in front of patient. I send to clinician's office or ask patient to come after 2-3 days. Usually patient doesn't come. His or her relative comes and take a report and take a consultations. So I think that government cancer hospital and psychotherapists or psychologists can, even medical oncologists are also very good in counseling patients. Uh, I had yesterday meeting two oncologists. Almost both counsel patient for almost 1 hour for cancer. Cancer counseling takes lots of time. So that's one message also. The one other patient was getting irritated because that medical oncologist took long time for one patient. So I had to explain that patient that taking time for this patient, your patient also will given similar treatment. More time clinician takes, it's good for you. He's explain you everything. Medical oncologists are also good counselor.
Sir, in a number of instances, people are always scared and, they are having kind of a myth that, by doing latent biopsy, etc., the cancer is spreading to other organs, which is not the case. I would like you to speak on this aspect as well.
None of technique spreads, whether it's a cytology or biopsy. We are using very small needles. And usually we take tumor directly from middle or center part of tumor. does not spread by whether you do cytology procedure or your true cut biopsies. It does not spread tumor except, particularly in breast, except some of tumors in the abdomen, which if you go from पेट पेट के पास से पार्ट से करते हो तो स्प्रेड होता है, पीछे से बायोप्सी करते हो तो स्प्रेड नहीं होता है. You have to forget about this. It does not spread with procedure. And suppose is a cancer of thigh part or any other muscle or any part. At the time of surgery, surgeon take out that track of the biopsy. So that track will be removed at the time of surgery. For the breast, if it is procedure has been done, uh, if it is chemotherapy to be done upfront, that will take care of why the surgeon oncologist is giving chemotherapy to kill the cancer cells in the body. Okay, and if it is not spread, I think after procedure within 5 6 days or 1 days, 1 week only the your completions excision will be done. Whether it's a complete mastectomy or some just excision biopsy, that entire procedure will be finished in 1 week. That will not cause harm to your body. That needle biopsy.
Right. Janet, please check if there are any other question answer. But today your slide presentation was absolutely meticulous. I mean, if someone is seeing these slides and paying good attention, I don't think that would be any doubts pertaining to the cancer or cells or treatment protocols, etc. So I must say that you have explained everything in a very flawless manner, and I think this was quite remarkable.
I think Mr. Avinash has a question. He can ask. Mr. Avinash?
Yes, sir.
Yeah.
Yeah. So my question is that is there any kind of food culture or lifestyle that is responsible for the breast tumor? Like in my known and like in my knowledge, in rural area or there is no case of breast tumor. So is there any kind of food culture or lifestyle and that is responsible for the same?
See, what I told you about lifestyle now, high calorie diet or lack of physical exercise or smoking or alcohol, in our body, every minute some toxins are generated. Okay. If you take proper food, what we call it balanced diet, if you do physical exercise, you avoid smoking and alcohol, those toxins are neutralized by proper circulations and proper nutrients you are getting in food. Like we get and we want antioxidant, vitamin A, vitamin C, your whatever breathing exercise are there, those are actually working as an antioxidant and removing the waste products of free radicals which are generated in your body. These free radicals, if are not removed from body, it will cause damage to your DNA, your genetic material, and that will be responsible for cancer. Our body has a limited power to repair the damage. Damage regularly, frequently means on the regular basis, damage occurs in our DNA or genetic material, but that get neutralized. But if that doesn't get neutralized, it causes cancer. That's why proper diet is important. Not particular diet is, but it should be balanced, proper diet in which you will getting proper vitamins and minerals.
Thank you, sir.
Welcome.
Sir, I also have a question. Actually, I have a report of a patient. तो मैं पढ़ के बताती हूँ उसमें क्या लिखा हुआ है. Report findings. Biopsy from left breast lump and left Axillary lymph node both shows features of an invasive carcinoma, NST. The next line, hormonal profiles of the tumor is ER negative, Allied score 0 /8 and PR negative,
Hmm.
Allied score 0 out of 8, HR2, HR2 uh,
HER2.
new, NEU positive, bracket में 3 plus.
Hmm.
So what does it mean? ER, PR and
I already told you. See, there are broadly divided cancer, breast cancer broadly. We are two type. With one is low grade. Majority are positive for this estrogen receptor. Estrogen receptor is hormone, and there is a treatment available for this estrogen receptor positive breast cancer, which is known as tamoxifen. And there are other category of tumor which histologically aggressive behaving, like this patient has. In those patients, estrogen receptor ER and progesterone receptor PR are usually negative, and HER2 is positive. There is HER2, there is a treatment against this HER2 positive cancer, which is known as Herceptin. And that treatment is very costly in lakhs. That's why I told if you have any doubt or plus minus result of HER2, you have to do HER2 fish. Because HER2 fish costing is about 9-10,000 rupees. And this Herceptin treatment is, if you complete the entire cycle, if it is not sponsored by any mm, trial, maybe about 15-20 lakhs rupees. Depends on which company drug you are using. So if you, once you before start cost uh, planning to start and deciding to get the treatment which is worth 15-20 lakhs rupees, better if any doubt, we reconfirm the HER2 reports. Sometimes what will happen, all three reports will be positive. Your ER, PR, HER2, all three will be positive. In those patients, even if it is not a published criteria, no, I ask oncologists to get HER2 fish report done, even if it is not standardized criteria. This is by my experience that now there are two options, tamoxifen and Herceptin. So all triple positive tumors, I ask if it just repeat that HER2 by fish technique. So just costing 9-10,000 rupees. So nothing. If you can afford 15 to 20 lakhs rupees, you can afford 10,000 rupees before starting. And we have seen the cases where where a positive in some other lab and my lab it was negative and fish were also negative and patient was need not to take Herceptin treatment almost save 15 to 20 lakhs rupees.
true sir. Uh, so sir यहाँ पे वैसे ER जो and PR है that is negative and
Negative.
HER2 is positive and
Hmm.
that is 3 plus. So
Hmm.
that
Treatment to be taken, but we have to see the nuclear grade है उसका जो ग्रेड है, लो ग्रेड हाई ग्रेड लिखा होगा, वो न्यूक्लियर ग्रेड का रिपोर्ट दिया है नहीं दिया है।
नहीं मुझे सिर्फ इतनी ही डिटेल्स मिली अभी।
यहाँ पर ऑलमोस्ट ठीक ही होगा। और you to be double sure you can get the Ki 67 key 67 done with fourth test which I told you, that
यस
you can
यस।
ask. Usually HER2 positive जो tumors होते हैं ऐसा, this such a cases will be very rapidly proliferating. Doubling time will be very short. So that Ki 67 results will be very high, more than 30% will be there. 30% tumor cells will be in the proliferation cycle. So that also test you can add on, but probably not required. Will be probably right. And second thing I told you, always ask your pathologist कि which clone, ERP or HER2, almost 7-10 companies will be offering this test, this reagent. Which reagent has been used is very important. Which platform has been done, whether it's done manually or whether it's been done automation. That's also very important. Currently, gold standard for HER2 testing is Ventana FDA, US FDA approved clone is there. Ventana 4B5 clone. that to be used.
Okay, sir.
So the
Thank you,
clone
doctor. I'll,
reagent company name and the methodology is very important.
sir, I'll pass on the
Yeah.
your recording.
Mm.
Thank you.
Sir, on the sort of on this last point, I'm just curious to ask one question. Usually, I mean, I'm not talking about you, but usually whatever's like, if patients or caregivers are asking such question, like, which reagent is used or which company use, usually the medical professional is bit reluctant, or rather they are not feeling comfortable in sharing the details. So in that case, how to handle such situation?
Yeah, I write in my all reports, miss these reports particularly which company, which clone, which station I am using. By default, my report, I think this report also will be there. If you read second or third page, do you have second or third page of this report? Usually it will be 3 to 4 pages report.
No, sir, I only get this
Yeah.
thing.
Get the entire report. Majority lab mentions which one they are using it.
Okay.
Right. Usually, is there any new
Just a minute.
question?
Just
Yeah.
a minute. And there is no harm in repeating HER2 ISC also. What is my practice is suppose HER2 testing has been done it at other lab and the patient come with sample. Today only one doctor sample came to me. He had a different result in 2019, 2022 and 2024. And the husband also was a doctor. They came for HER2 fish. So I told, give me all the blocks 2019, 22 and 24. I usually repeat HER2 ISC, that HER2 ISC and do HER2 fish also for comparison. Ideally, HER2 fish and HER2 ISC result to be reported together, not in isolation.
Okay, sir. Noted.
And it can change. First time it is negative, it may become positive next time because tumor has progressed. It become fast growing from slow growing. It's possible that first time results were negative, second time it comes positive, become positive. Yeah.
Got it, sir.
Rechecking is not harmful. Rechecking will you maybe what I don't know how much it costs just 2-3 thousand rupees for repeating auto.
बट सर इट कैन लाइक जैसे आपने बताया कि लाइक हर सेप्टेन वाला एक जो काफी कॉस्टली
हाँ तो
ट्रीटमेंट है
इसलिए तो
जिसकी
बोला
वजह
that's why I'm telling
या
even not if you are not going for her to fish, you can ask for a repeat her to ISC. It's just 2-3 thousand rupees cost. It's nothing compared to 15 to 20 lakhs.
एग्जैक्टली सर थैंक यू डॉक्टर आई विल टोटली पास इट ऑन एंड दे मे बी हियरिंग राइट नाउ
Yeah.
Good. Usually, is there any more questions?
नो सर नॉट राइट नाउ
You can text me any queries there on my WhatsApp. Possible, I will try to answer.
श्योर डॉक्टर
Okay.
आई विल टेक योर कॉन्टैक्ट फ्रॉम श्रेनिक सर
Yeah. Yeah. Fine.
Great. So, sir, thank you very much for your commendable and descriptive descriptive knowledge sharing, experience and expertise sharing, and we really thank you very much for your valued time, and we look forward to receiving you once again in the coming months. Of course, not for the breast cancer, but pertaining to uterine cancer or any other. So, thank you once again for your valued time. Thank you.
Welcome.
Thank you, doctor. And it was really a fabulous session. Very well explained everything.
Thank you.
Even you have addressed the myths before, as in कि मेल ब्रेस्ट कैंसर के बारे में सब लोग बहुत ज्यादा इम्पोर्टेंस उस चीज को नहीं देते हैं, बट आपने वो
Hmm.
वाली चीज एड्रेस की, एंड द एज फैक्टर्स, इट वाज अमेजिंग. थैंक यू सो मच डॉक्टर.
Welcome. Thank you.
Thank you, sir. Thank you very
Thank
much.
you.
Bye.
बाय सर.
Thank you, sir.
Bye.